It's a pleasure to have with us today Dr. Joseph Ladapo from UCLA, professor of medicine and also of public health, health policy. Thanks for joining me. And I think I want to start, like I'm asking a lot of our guests, to go back to March, to the beginning of, and perhaps even March, things were already happening on your end, given that you're in the hospital seeing patients and so on. But for a lot of us, that's when we started really thinking hard about, okay, this is serious. What do we need to do here? And one of the first things I read from you was already really facing very clearly the trade-offs that we're facing at that point in time, and putting it in a way that I didn't see coming from a lot of health officials in particular at that point. So let's try to go back to there and tell us what you're thinking. What was your sort of, what evidence you're looking at, what are the models you're looking at, and how you're reacting at that point in time?
Oh, yeah. Well, thank you for that. And in terms of what I was thinking, what models, I think the big model at that time that most people were citing was the one out of England. I forget the name of the group right now. But
Imperial College.
Yeah, exactly. Yeah. And and they did, I completely commend the job that they did. They got some things wrong, which is like, but it was still useful, and it was important to do something to give us, some place to start. So that model predicted some things that were pretty dire based on the data that they were using. And now we know that they overestimated mortality, for example. They overestimated disease morbidity, which is totally fine. We know more now than we did then. And using that information, it painted a pretty dire picture. But it's really important to think about what we are doing, why we're doing it, and where we're headed with what we're doing. And I spend a lot of time. Obviously, I've spent a lot of time taking care of patients, and I fortunately have a quantitative background, and took some extra years in med school to get a PhD in health policy, and mostly economics and statistics and decision analysis. So that was very helpful for me in sort of thinking through the problem and thinking, and it also helped me, I think about the trade-offs. So kind of all together, that's what led me to my suggestion. And it was really clear that our leaders had no idea what they were doing. I mean, if you remember, it's kind of been almost laughable, right? Like, it was first, groups no more than like 100, and 50, then 10, and this and that. And it's just like when people were changing their mind like that, they really, they don't know what they don't know what they're doing. Ultimately, that's like the bottom line, which is fine, There
was a lot of uncertainty at that point in time.
Yeah, there was. But I would say that despite the challenge of the circumstances, there was a lot of information too. We had a lot of information from China, and we also knew what the consequences of shutdowns would be. I mean, you don't need, I can talk to I've got 3 little wonderful boys, and I can talk to my oldest 6, and he can think through what the consequences of, no school, and and people not being able to work, and the fear and hysteria and all that can produce could be. They're not complicated concepts, and we don't need to know anything about COVID to be able to think about the consequences of some of our decisions. So I clearly it was difficult, clearly, for a lot of people to sort of see through sort of the fog and the haze and all that was happening. But it was still very clear what was likely to happen with our decisions. So that's sort of what led me to write.
So I think the main point you were making at that point in time was to say, keeping a lockdown short to give us time to prepare our health capacity. This is going to come, and there's too much already community spread for us to stop this. So
especially in this country,
right?
It's freezing.
And what should be a short lockdown to perhaps give us some time, but make it short so that people can have their lives back, because otherwise it's not going to work.
Yeah, what's the point? Where are we heading? I mean, we live to live. That's why we live. We don't live to be fearful and not educate our kids and not be able to pursue the things in life we want. Um, and which is not to say that people shouldn't be fearful or shouldn't take whatever precautions they want. It's more just to say that that shouldn't be forced on everyone, which
So
is what.
what was the reaction of your colleagues? Were your colleagues did they have a similar reaction to the situation as you, or because I think unfortunately those voices, to me at least, my perception, those voices were somehow not as large as the voices saying stay at home, don't dare to go out,
Oh
let's do this for as
gosh.
long as it takes.
Oh man, yeah, no question. And that itself should give people pause, over policy issues. I mean, over moral issues. You probably hear my kids in the background. So over moral issues, there's every reason to believe that, we can have uniform beliefs as a society. But over policy issues, it's usually not such a good idea if everyone is saying the same thing and not really allowing dissent. And there was definitely an atmosphere that was pushing out dissent, or at least was at the very least hostile to it. And my perspectives, and my wife and I were like on the same page. We've been on the same page the whole time. And in general, my colleagues have not received it particularly favorably, and that's fine. Um, Although I struggled even then, and one of the things I do, and I advise other people that I work with to do, is to really try and understand the opinions of other people. So I spend a lot of time trying to very well understand what my three, oh goodness, the voice, um, what other people thought and why, and I think I understood why, but I struggled because it really should, just as it was very obvious to me why, because it meant, their goal was to take a just to stop COVID. That was their goal.
At all
And I
costs.
get that. Well, that's the thing. I think the cost part wasn't really internalized. It was just, we gotta stop COVID, we gotta stop COVID. And we're seeing that, the costs have been more than my mind can fathom. We hear the numbers about unemployment, and we hear the numbers about higher rates of anxiety and depression. Um, we don't see what's happening with kids in particular. It's ironic because they suffer the least from the disease, but they are definitely suffering the most from what we've done about the disease, our response, and the loss of structure. And we're really lucky, personally. Our kids, we've been very careful not to sort of fill them with fear about the virus and things like that. And they've been fine. They haven't been getting a lot of great school education. We do what we can at home, uh, but a lot of children are undoubtedly suffering greatly from the loss of the social connections and from the
And they don't
education.
have homes as good as ours home in terms of, like, fortunate as ours in terms of access to things and so on, right? So you can see in some situations children having a much harder time than our kids are having.
Yeah, 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 yeah. And then not to mention all the young people who've lost employment. I think older people who have sort of have savings and more um, just more of a nest to sort of be able to weather out the shutdowns, probably have done better, even though they've suffered also from the social isolation. But it's been quite costly, and I think if we had, it's not that I want, obviously we want to do as much as we can to prevent people from dying. But we've really gone about it in a very fear-fueled way that just hasn't served us. And COVID's still here, and it will continue to be here.
So
But
let's fast forward to now then, like to where we are, and we learned a lot more about the disease. I think we're all wrong in the sense of how severe, right, the mortality of the disease is, and
yeah,
it's thankfully it's not as bad as we thought. And we are at a stage now where we have, at least in the US, a number of different states opening up, people getting back slowly to their lives and in various stages across. That's true for other countries as well. So where do you see this moving forward now? What's your sort of expectation of how this is going to unfold?
Yeah. Yeah, I think about that quite a lot. And, with the terrible killing of George Floyd, I think that's also changed the dynamics, because we've basically gone from this environment where, at least in some states, like in California, there was tremendous sort of restrictions. There have been tremendous restrictions from the governor in Los Angeles, from the mayor in LA County, on people's activities and gathering and all this stuff. And the protests have blown that open. They've completely blown that open. And it is a political component. There are people who tried to protest the shutdowns, and they only were criticized. These protests are much larger, and they are not. They don't face the same criticism, and they shouldn't face the same criticism. In fact, none of the protests should have faced criticism. Right? It's people absolutely have a God-given right to express their opinions. And where they could get away with restrictions, they've gotten away with them. And these protests have just blown that open, and it makes it much harder to get away with restrictions. So I think what we're going to see is like this continued shift of power from leadership back to the people, which is great. And so I think in the public space, there are a lot of social advantages to that, because people need other people. That's how we work. That's how we thrive. That's how we find happiness. So that part is good. In terms of policy restrictions on workplaces and gyms and whatever other locations, schools, I think that, in fact, how things are transitioning with the protests, with a lot of people just having a lot of fatigue from the shutdowns and the restrictions. I think that there may be some room to see more kids back in school, even in a place like LA that's tried to be, sort of on the extreme of really trying to hold things down and control things. So I guess, yeah, so those are my main.
Okay, so that's the good side, I suppose, but how about the disease? What's now, given that what we learned, and what has been your experience, I guess, lately in the hospital, and how are things progressing? Are you guys preparing for a big wave, or do you think it's going to come, or what is the evidence you're looking now to prepare for that?
Yeah, great. That's a great question. I mean, I think the cases are going to keep increasing. There are already a lot of preparations happen in our hospital and other hospitals for capacity. So that's good. We also know even more now. So we know the people who are really, really at risk, and that really points to people living in nursing homes and skilled nursing facilities. And by the way, that doesn't mean that they should not be able to see other people. I think it just means that we need to think harder about how to live with this. So maybe we need more frequent testing among like their family members so they can visit them. Or maybe, the visits should happen outside, or other changes should be made. But we know a lot more. And in terms of a surge, I would be very surprised to see that outside of New York City. Very, very surprised. The reason is because we know so much now, and people are voluntarily doing stuff to reduce their risk. Like, people are doing that. So I think it's unlikely that we'll see a surge. I expect that cases will continue to increase.
There's no escaping that, right? So
yeah, I don't think so. I don't think so. I certainly pray we get really lucky and it disappears, but I don't think so. I think this is it's here to stay at least for a while. And even after a vaccine comes, it will, assuming we have one that's effective, it will continue to be here.
And just to close it up, I know we're short on time. Have you seen improvements in the way you guys are able to treat patients? Is that something that we're learning as we go and we're getting better at it? Or unfortunately something that really, it is what it is and there's not much we can do?
Yeah, I think there have been improvements. We've learned about proning of patients, positioning them to improve their respiration. I've seen a lot of literature about delaying intubation. So, and some patients tolerating low levels of oxygen better than previously thought. And, and we've had some favorable reports in terms of drug efficacy for treatment. So that's all pointing in the right direction. And I would not be surprised if we see even more, another favorable agent. There are just an unbelievable number of clinical trials ongoing right now. So, I would expect that we'll find at least one or two more like robust, effective treatments for the condition, which would be great.
That's fantastic. That's a good end, good high note to end this. Thank you for all what you do and all the writings you did. I think were very, very helpful for me to read and I think to help people understand different ways to think about this problem, especially as people that try to evaluate public policy like I do and like my students in the classes that I teach. It's always very important for us to focus on trade-offs, and you were there from the very beginning. So thank you for that.
All right. Thanks, Carlos. All right.
Thank you. Bye-bye.